Hello, this is Dr. Whiting, and today I want to talk to you about something that all of us are concerned about. If it doesn't affect us personally, it's just a matter of time before it will, and we certainly know dozens of friends and relatives who have chosen to be concerned about this, and that is cholesterol. Unfortunately, there's a lot of misinformation about cholesterol. If you were to ask almost anyone what is the major cause of heart disease, they would of course tell you excess cholesterol in your blood, and they would be 100% incorrect. In fact, there are no medical studies in any medical journal in the last 40 years that have even remotely been able to prove that cholesterol actually causes heart disease. But we all love an enemy, and now we have something to treat. The point is that cholesterol is actually much more valuable to you than most of us realize. Cholesterol is vital to your brain function. In fact, the majority of your brain tissue is cholesterol. Your nervous system, that coating, that insulation over each and every nerve called the myelin sheath, is almost 100% cholesterol. Cholesterol is so important to your life, health, and well-being that at least 80% of the total cholesterol in your body at any given time was manufactured, not eaten or consumed in regular diet. It was manufactured by the liver because it is so vitally important to each and every one of us. Low cholesterol levels are actually far more dangerous than elevated, and we'll talk about that in a minute. Now, if you have elevated cholesterol, it's not going to cause heart disease, but it certainly can make existing arterial problems much more complicated as it begins to stick to damaged artery walls. So for this reason, we don't want to have excessively high cholesterol. But the hysteria over elevated cholesterol has just got so far out of proportion that doctors are putting people on dangerous, potentially dangerous statin drugs for cholesterol levels that are just a few points above what the new normal is considered. Now, if you have elevated cholesterol, you have a liver problem, because it really doesn't matter, within reason, what you eat. Because you see, we don't actually eat cholesterol. The majority of it is made in the liver. Okay, so if you go on a high cholesterol diet, let's say, because you happen to like lots of the taste of fats, you like shellfish, those types of things that are known to be high in cholesterol. Well, if your liver is healthy, what it will do is it will start to turn down the production of cholesterol so that it balances out. Now, on the other hand, let's say somebody scares you half to death over this elevated cholesterol, and you go on this fanatic low-fat, low-cholesterol diet. Your cholesterol levels will probably dip 10, 15, maybe even 20 points. But over about a 3 or 4 or 5 month period, those levels will start to rise again because the liver is adjusting for the lack of cholesterol in your diet. The problem is that if you have cholesterol certainly above 220, your liver is not regulating it properly. It's like a thermostat that's not regulating the temperature of your house. And so what we need to do when we talk about normalizing cholesterol or controlling cholesterol, we need to address the liver. A liver that is toxic cannot perform its many hundreds and hundreds of functions on a daily basis. And one of the many hundreds of functions of the liver, of course, is to regulate blood fats. And when it becomes toxic from environmental exposure, things we ingest, so on and so forth, then it becomes much more difficult for the liver to handle this situation. Okay, we talked about elevated cholesterol. What about low cholesterol? What most people don't realize is that cholesterol levels that are too low are far more dangerous in the immediate moment than oftentimes elevated cholesterol. In fact, statistically, if your cholesterol levels, total cholesterol, is below 150, the chances of you having a cerebral hemorrhage or stroke are 10 times greater than if they were elevated. Now, I'm not telling you that elevated cholesterol shouldn't be addressed. It should be. But I'm not certain that statin drugs are the answer. Why? Because statin drugs are extremely potentially dangerous. In fact, statins are only one of a very small group of drugs that the Food and Drug Administration requires routine blood tests to ensure your safety. That means that if you're taking a statin drug, you're going to need to have a blood test every few months to make sure it's not permanently damaging your liver. Now, when I look at the risk versus the benefit, I always tell people you can always use the statin drug later. Let's try a natural approach first. Now, what is that natural approach? Well, there are several things that we can do to address this problem. The first thing we need to do is, of course, to nourish and detoxify the liver. We do that with such things as gugu lipids, pantethine, and other amino acids and fast-acting nutrients. We also can help lower the existing elevated cholesterol in your bloodstream with things like oat bran fiber and various other sources of fiber. Now, we combine all of these nutrients together and create a formula that has helped thousands of people to normalize their cholesterol safely and naturally without the high risks of many of the statin drugs. Okay, what else do we need to know? Well, we need to know essentially that cholesterol is natural, it's healthy, it's normal, it's necessary. And you can, in fact, lower cholesterol levels very effectively, in many cases, through natural substances. Okay, so our program for cholesterol management would be, first of all, to detoxify and cleanse your liver. Then we want to nourish your liver with the proper nutrients. We want then to remove excess cholesterol from your bloodstream by the use of various fibers. Now, many people ask me, what about diet? Does diet really affect your cholesterol? Very minimally. The only thing that I would suggest you eliminate from your diet, which I suggest for all of my clients, are the vegetable oils. Yes, those are the ones that we've been told for decades now are the healthy ones. The polyunsaturated vegetable oils, safflower oil, corn oil, even the sesame oil, and there's many of them. The polyunsaturates tend to form free radicals when they're exposed to air and heat. Further, when you ingest these rancid or oxidized oils into your system, the liver has to detoxify them. And over time, these rancid oils can make your liver quite toxic. Other than that, we really don't eat cholesterol in the long run. Now, what about triglycerides? I want to take just a second to talk to you about those. Triglycerides are far more dangerous than cholesterol because their molecules are much larger. So if anything is going to plug up the hose, so to speak, it'll be the triglycerides. Now, you can easily lower triglycerides in two simple ways. Number one, increase exercise. And number two, lower the amount of carbohydrates, especially refined carbohydrates like sugars and white flour products, to a minimum. Because it is from those food sources that is the primary source that the body builds the triglyceride. Okay, if you are interested in finding out ways that you can naturally improve your blood fat profile, lower your cholesterol safely and naturally, I have some resource information for you. First of all, you can reach us toll-free at our research center in Southern California by dialing 1-888-454-8464. You can also view our website at www.healthyinformation.com. If you have a personal question for me, you can always reach my office directly by emailing me at askthedoc@healthyinformation.com. Cholesterol need not be the feared substance that we have been taught. And if you do have elevated cholesterol, please remember that it's more than likely a liver problem, and we can address and fix the liver so that it naturally takes care of regulating cholesterol on your behalf. I'm Dr. Whiting. Thanks for listening.